Hi guys, my name is Jabari Mitchell, and this is my return demonstration on full head-to-chest assessment. um, so here is my ID for reference. Just check around the room. Okay. All right. So the first thing that we're going to do before we walk into a patient's room is we're going to wash our hands. So, hi, my name is Jabari. I'm going to be your nurse today. I'm going to do just a head-to-chest assessment on you today. Is that going to be all right? Okay, excellent. So the first thing that we're going to start with as a nurse is we're going to assess the patient physically. As they're walking into the room, do they have a smooth and even gait? Are they able to walk on their own? Do they have any assistive devices? We just want to take note of anything that we see right off the bat that we want to address with this patient. So that's going to be the first thing that we're going to be looking at. As the patient's walking in the room, as we're walking into the room, we're going to be assessing this patient, looking at, do they look like they're nourished? Do they look like they've taken a bath recently? Do they look like their skin is in good condition? Do they look like they've been out in the sun? Just like any signs of abnormal findings that we could see just from looking at the person first off. And so, sir, the first thing that I'm going to want to ask you is, do you have any allergies that I should know about today? No? Okay, great. And then if you could rate your pain for me today on a scale of 0 to 10. 0 being the least pain and 10 being the worst pain you've ever had. A 0? Okay, excellent. That is great. So, sir, I'm just going to count your pulse here and get a few vital signs from you. So let's see. Okay, his pulse is at 92 beats per minute. Let's listen in for respirations. Okay, his respirations are at 18 breaths per minute. We're going to give him temperature. Okay, his axillary temperature is at 98.6 degrees. That's perfect. Just what we're looking for. Okay, and his oxygen saturation we've taken, and we've seen that he's at a steady 99% oxygenation rate. So his vitals are all within the normal, what we consider normal ranges. Okay, so the next thing that we're going to move on to is skin and nails. The first things we're just going to palpate the skin all around and just kind of make sure that we don't see any pallor, any cyanosis. Don't see any pallor or cyanosis. If we see any age spots that we need to know about, if there's any lesions on his skin that we see here or anything. I don't seem to see any lesions or abscesses, no vesicles, no blisters, and no extra pale spots or extra red spots. I don't see any rashes. So his skin looks to be in a pretty good shape. Let's check the turgor. Now I would do check turgor by pinching the skin like this and seeing how fast it bounces back. So it looks like his skin turgor looks to be good. The integrity looks to be good. It's not too wet, not too dry. He's not sweating or diaphoretic. So then we'll move on to nails next. Nails, we're going to check for any clubbing. Clubbing could be a sign of COPD or some other respiratory exacerbation. We're also going to check for capillary refill. So we're going to depress his thumb just like that and check to see how quickly the red comes back into his thumb. If it's under 3 seconds, which it is with him, that is within a normal range that we should be looking for here for him. We also want to check for thickness of the nails, making sure that they're not getting too thin. Maybe we need to supplement with some vitamins, especially if the person's older and it looks like the nails may break or something like that. Or maybe a special nail polish or anything like that. Okay, so next we're going to move on to the head, the face, and the neck. And so the first thing we'll start with your head, sir. So with his head, we're just gonna look at the symmetry of his face first of all, and make sure that one side isn't like drooping or anything like that. Just making sure that there's no lesions on the skin, where we don't see it, maybe any like cold sores that we should be addressing, anything like that on his face. Or making sure that the skull seems intact all the way around, that there's no tenderness anywhere. We want to check and just palpate around for any tenderness. Make sure there's no lesions, any like maybe head lice or fleas, ticks, anything like that. We're assessing the hair, making sure that the hair is clean and not too oily or not too dry, anything like that. Making sure that's if the patient has any questions about the hair getting thinner and things like that, that we are able to address those questions appropriately and give them good treatment options for that. So like I said, with the face, we're going to want to make sure that it's symmetrical. You're going to want to make sure it's symmetrical. And the neck, okay, we're going to palpate the neck. The lymph nodes that are here in the neck, we're going to palpate and just see if there's any hardness. Lymph nodes should be movable, and lymph nodes should be movable, and they should be soft, and they should not be tender at all. So that could be a sign of an inflammatory disease or leukemia if we're seeing hard or raised lymph nodes, or tenderness to the touch of them, or if they're warm. So we want to look at that. We also want to check, thyroid, to make sure that there's no that there aren't any thyroid problems that we want to be looking for, like a goiter maybe, or sometimes it's also a sign of infection or hyperthyroidism. They could have Graves' disease. I want to be checking to make sure that they don't have that ophthalmos, where their eyes are kind of popping out of their head a little bit. We also want to look for check their neck to make sure that there's any jugular vein distension, although we'll get to that later when we do the cardiovascular part of it. Okay. So the next part that we're going to go to here, we're going to check out his eyes. And so I brought my pen light here with me. One of the first things that I'm going to do here is I'm going to check for pupil dilation. So I'm going to take my pen light, I'm going to shine it into one eye. I'm going to check both eyes bilaterally to see if they, when I shine the light in, the pupil should dilate and get bigger to take in that more, or it should constrict and get smaller. And as I take the light away, they should dilate back and get bigger again. And we want to check for this bilaterally. We want to see if I shine the light in one eye, is the other eye should do the same as the one eye. So if I shine the light in one eye, both eyes should constrict. Okay, and we want to check their sclera, which is the white of their eyes, to make sure we don't see any jaundice or like broken blood vessels, anything like that that would be out of the normal. It should be white. The sclera should be white, and the conjunctiva should be pink or red. We're going to want to pull down this and this pink under their eyes. It should be pink, and there shouldn't be any drainage. Shouldn't be any lesions or abscesses. We just want to check to see. Sometimes there can be pus or drainage that can be coming from the eye. That could be a sign eye infection or just other things. Okay. Alright, so okay, ears. So ears, what we're gonna do, as I'm talking to this patient, I would say, can you hear me? Can you hear what I'm saying over here? Alright, sir. Do you hear what I'm saying over here? It's a whisper test to find out if the patient can hear the same in either ear. We want to find out if the patient can hear me whisper from a low tone to them, if they can hear that. Just making sure that the hearing is good on either side. If I had a tuning fork, I could do a few more tests to find out to assess hearing further. And also, while I'm doing the ears, I'm going to take my pen light and just check in the ear, make sure that there's no drainage or pus or anything. Make sure that there's no blockages that I can see just from as far as my light goes. And just make sure that it's clear and free, and that their hearing hasn't taken any. Their hearing hasn't had any declines lately. This is a self-identified break. I did miss on the eyes. I would ask them to read a card from far away and maybe read a card up close, so that we could assess like nearsightedness or farsightedness. Okay. So the next thing that I'm gonna want to check. Okay, eyes. The next thing that I'm gonna check is the nose. So once again, gonna take my pen light here, and I'm gonna shine it up your nose here, sir. Okay, and as I'm looking up, I want to look for a deviated septum and see if there's any deviations in there. I want to ask the patient, do you have any deviations that you know about? Are you able to breathe out of both of your nostrils really well? Do you still have a sense of smell? Is there anything different with your sense of smell that you've been hearing lately, or that you've been smelling lately? We also want to check for bilateral patency. So, sir, if you could just hold one side of your nose and blow out the other, like that, like that. So his bilateral patency looks good, but there's no blockages up the nose. It doesn't seem like his nose is running. His nose is the septum isn't deviated. There's no drainage, no pus. I don't see any nodules or pustules up in his nose either. There could be signs of infection that we'd see there. Okay, so next I'm gonna do the mouth and throat. So, sir, do you think you could open your mouth for me and say ah? Okay. So we're going to check when I put my popsicle stick back there, his uvula should go up. We should see it go up and tighten up towards the roof of the mouth, the back of the mouth there. We're also checking in here for any for gingivitis. We want to look at his gums, make sure that there's no bleeding on the gums, or that they look good and have pink color. Make sure his lips have good and pink color, and that they're not bleeding or anything just unnecessarily, or that they're unattached from the teeth. We want to check his teeth, make sure that they don't have any cavities. We want to make sure it takes the breath, make sure they don't have a sweet smell to their breath. Meaning that they may have diabetes, or diabetes may be out of control. Also, we're going to be checking the tonsils in the back of the throat. His tonsils are +2. meaning that they're a little bit swollen, but not to the point. +4 would mean that they're all the way touching each other. So his tonsils looked a little bit swollen, but not anything that we need to be too concerned about right now. Now, if they start to touch the uvula or if they start to touch each other, we're having a problem with swelling of the tonsils in the back of the throat. Okay. All right. So I'm thinking that. So the next part of the assessment, sir, is going to be your respiratory. Nope. Okay, the next part, sir, is going to be your respiratory system. So if you could take your shirt off for me, which you would be taking your shirt off at this point, just so I could see, so that I can put my stethoscope directly up to his skin. And I'm just going to listen to a few sounds on you, sir, okay? All right. So first I'm going to start with the anterior. Okay. Using the diaphragm. Okay. We're going to auscultate for. Sir, could you just breathe in for me deep each time that I go to a different place? Breathe in deep for me, all right? Okay. All right. Good. Okay. So. Okay. All right. Okay. All right. So anteriorly, everything, his breath sound good. I don't hear any crackles or wheezes. Let's go to posterior. Okay, let's see what's in here. Breathe deep. Breathe deep. Okay. And breathe deep. Okay. Okay, now I'm gonna listen to lateral sounds. Okay. So this is going to be the left lateral. Could you raise your arm for me, sir? Thank you very much. So the left lateral will only have the left lung only has 2 lobes. So we're gonna listen here. Okay, we're gonna listen here. All right. Let's do the other side laterally. Listen here. Right side has 3 lobes, so we're gonna listen in 3 separate places on right side. Okay. So, as I'm listening to these lung sounds, I want to be listening bilateral. That's why we go in a Z pattern. Is so that we go in a Z pattern so that we're listening from one side to the other side, and we're comparing the two to make sure that one lung doesn't sound different than the other, because that would mean that there could be a problem with one lung, and it's getting less oxygen than the other. So, okay, so that was our lung sounds. Yeah, and like I said, no, I didn't hear any cracking or wheezing. Sir, do you have any history of respiratory illnesses that I should know about, like asthma or COPD or anything? Okay, he says no. So, yeah, I didn't. I also, as evidenced in the nail part, he doesn't have any clubbing of his nails or anything, so it doesn't look like any chronic respiratory illnesses are there. And his lung sound good today, so I think he has a good bill of health with regards to his respiratory system. Okay, and next we're going to go on to his cardiovascular system. So, sir, I'm going to palpate your carotid pulse here. Okay. I'm going to take these two fingers, put it right on the carotid pulse, right next to the trachea. We're going to listen for a feel. And then we're going to palpate the other side, and we're going to listen for a pulse, or feel for a pulse there. Okay. Okay. And also, as we're inspecting the patient, looking at them, we're checking to see if they have any jugular vein distension while they're sitting up. The next thing we're going to do, sir, I'm going to lean your bed back just a little bit here, put you at a 45-degree angle. All right, and as you're at this 45-degree angle, I'm going to check once again for jugular vein distension, seeing like as he's leaning back, does this jugular vein start to pop out? Can I see it pop out kind of? Okay, sir, you can sit back up. Thank you. Okay, now, sir, I am going to auscultate your carotid and jugular sounds. I'm going to listen for carotid pulse on each side of his trachea. Okay, I hear the carotid pulse, and while I'm listening to that, I want to listen for any like swishing noises that you would hear, or we would call it a bruit. So I'm listening for that, just or any type of regurgitation, murmurs, things such as that. Okay. Now, now I'm going to check for radial pulse. And we're going to listen down here, right in here, on the radial, inside the radial bone. And we're going to check to feel that we feel a pulse here. Okay. All right. Excellent. We feel a good pulse there. Okay. The next thing I'm going to do is, sir, I'm going to listen to your heart sounds now. That's going to be the next thing. Okay, so there are 5 separate places where we're going to listen on our patient here. I do this with the diaphragm first. Okay, so right side, second intercostal space, right next to the sternum. We're going to listen. It's going to be the aortic. Second intercostal on the left side, right next to the sternum. That's going to be our pulmonic valve. Okay, and then fourth intercostal space, right next to the sternum. That is going to be our herbs spot. We're going to listen there. And at this point, we should hear equal sounds between S2 and S1 down here. So we should hear equal sounds from both sides. And that's what I'm hearing now. Okay, great. Now, we're going to move down to mid-sternal, fifth intercostal space. And on our left side, this is going to be our mitral valve right here. Okay, that's S1. And then on our right side, mid-clavicular, fifth intercostal space, down here, we'll hear our bicuspid valve. All right, excellent. Now I'm going to repeat all of the spots that I just did with the bell auscultate with the bell of my stethoscope here. So, aortic, pulmonic, herbs, mitral, bicuspid. Okay. Alrighty here, sir. Okay. Sir, Thank you very much for letting me do this assessment on you today. Is there anything else that you have questions for me right now? No? Okay, excellent, sir. So the last thing I want to ask you before you leave, are you in any pain right now? 0 to 10. 0 pain? Okay, excellent. Well, sir, thank you very much for coming in. If you have any questions, feel free to call the clinic. And I'll see you next time. Thank you very much. Okay, and last thing, I'm going to wash my hands, and then I'll leave the room.